All right, let's dive in. Today, we're going to pull back the curtain on one of the biggest, most under-the-radar threats to our health. We're talking about a process that works in the shadows, quietly shaping how we feel, how fast we age, and our risk for pretty much every major disease out there.
I want you to just let that question sink in for a second. What if the biggest threat isn't some sudden virus or a crazy accident? What if it's a slow burn happening inside you right now? Because the answer to that, well, it might just change how you think about your own health forever.
And that slow burn has a name. We're calling it the body's silent fire. It's this hidden force that science is now realizing is a central player in the story of our health. So what is it exactly? The official term is chronic inflammation. But honestly, the best way to picture it is as a smoldering fire. It's not some big raging inferno that you'd notice right away. No, it's more like embers, just glowing away at a low heat constantly. And over years, even decades, that persistent low-grade heat slowly damages the very building blocks of your body, your tissues, your arteries, all the way down to your DNA.
And because it's a smoldering fire, it doesn't scream for help. It whispers. You know that nagging fatigue you just can't shake? Or that stiffness you feel in your joints in the morning? Maybe it's digestive problems that just never seem to go away. Or that brain fog you keep blaming on a bad night's sleep. Well, these are the subtle clues, the whispers from that fire, telling you something deeper is going on.
So how on earth does this even happen? Well, here's the crazy twist in the story. Inflammation isn't supposed to be the bad guy. In fact, it's designed to be our hero. So what happens when that hero turns into a saboteur?
Think of it like this. Inflammation has two completely different faces. On one hand, you've got the healer. That's acute inflammation. You get a cut, you sprain your ankle, and your body sends in this rapid response team to protect you, fight infection, and start the healing process. It's short-term, it's powerful, and it's absolutely essential for survival. But then there's the saboteur. This is when that same protective response never gets the memo to shut down. It just keeps going, becoming long-term, silent, and incredibly damaging, actually driving the aging process itself.
So really, the whole problem boils down to one simple thing. Your body's protective alarm system is supposed to have an off switch. In chronic inflammation, that switch is broken. The alarm just keeps ringing quietly in the background, day in, day out, causing all sorts of collateral damage throughout your entire system.
So you're probably asking, okay, so what breaks the switch? And the answer, more often than not, is found in our modern lives. So let's talk about the everyday triggers that are constantly fanning these internal flames.
I mean, this list is basically a snapshot of life in the 21st century, isn't it? Highly processed foods and way too much sugar. That's like pouring lighter fluid on the fire. Chronic stress keeps your body's alarm system on high alert 24/7. Poor sleep robs your body of its crucial repair and reset time. A sedentary lifestyle, especially when it leads to that deep belly fat, visceral fat, is a huge contributor. And yeah, even the natural process of getting older, something scientists are now calling inflammaging, adds to the pile. And here's the thing. The danger isn't one stressful day or one donut. It's the cumulative effect. It's stacking these things up day after day, year after year. That's when their power becomes massive, slowly and quietly eroding your health from the inside out.
So what's the ultimate price we pay for this silent fire? This is where the story gets really serious, because we're now seeing a direct, undeniable line between chronic inflammation and the biggest health crises we face today.
In fact, researchers now have a name for it. They call chronic inflammation the common denominator of disease. And it makes sense, right? Because it's the underlying problem that helps kickstart so many different conditions. It damages the walls of our arteries, leading to heart disease. It messes with our insulin response, paving the way for type 2 diabetes. It can even create an environment in our bodies where cancer cells can thrive. And we're seeing it's a huge factor in neurodegenerative diseases like Alzheimer's and Parkinson's.
Now just look at this number for a second. Greater than 50%. According to the World Health Organization, over half of all deaths worldwide are now linked to chronic inflammatory diseases. This is not a small fringe issue. This is one of the central, if not the central health challenge of our time.
Okay, I know that was all pretty heavy, but here's the good news, and it's really empowering news. This is not our destiny. We have a huge amount of control over this story. So it's time to pivot away from the problem and talk about the solution. Let's talk about how we can start to put out that fire.
This is your action plan, and the power here is in its simplicity. We're not talking about anything radical. It starts with what you eat, prioritizing whole foods, colorful fruits and veggies, and healthy fats like omega-3s. Then, you've got to find ways to manage stress, to calm that always-on alert system. Next, protect your sleep. Treat it like it's gold, because that's your body's non-negotiable repair time. Get moving. Even a brisk walk every day works wonders. Support your gut health, because it's the command center of your immune system. And finally, ease up on the things that are known to fan the flames, like alcohol and smoking. It's all about making small, consistent choices that turn down the dial on that internal fire.
And you know, the story doesn't stop here. Our understanding of inflammation is exploding, and what's coming next is genuinely exciting. We are literally entering a new frontier in how we think about health.
Just imagine, in the very near future, we'll be able to detect this dangerous inflammation years before symptoms even show up, using new biomarkers. Treatments are going to become super personalized, targeting the specific pathways that are causing you trouble. And with the wearable tech we're already using, plus AI, we'll be able to monitor and manage our inflammatory state in real time. This is what true, proactive, preventative health looks like.
Ultimately, this whole shift toward understanding inflammation is about so much more than just treating disease. It is a fundamental change in perspective. It's about moving away from just reacting when we get sick and moving toward actively and consciously building a strong foundation of health day by day. So the real question is, how are you going to start dousing your own silent fire?